In this video today, we talk about a treatment for back and leg pain that's using minimally invasive spine fusion, how that differs from traditional spine fusion, and why this offering from Spinal Simplicity may be a good fit for you. If we haven't met, I'm Dr. Orlando Landry, an interventional pain and regenerative medicine specialist who teaches patients on our channel, Cutting Edge Pain Relief, their options for pain relief, improved function, and how to be able to punch pain in the face and get back to leading the life that you deserve. Today, we're talking about minimally invasive spine fusion through a product that is offered via a company named Spinal Simplicity. So traditional fusion involves a midline incision that cuts through major muscles of the back and traditionally has an implantation of something that's called a pedicle screw, which is a screw that's drilled into a part of the bone to provide stabilization and then is connected to different instrumentation, traditionally rods that provide stability at that level. That stability prevents micro movements of the components of the bone in relationship to other areas of the vertebrae that prevent pain and dysfunction. There are times when traditional fusion is undoubtedly needed, but there are other times when it may not only not be needed, it also may not be doable. For those individuals that have severe cardiac disease, pulmonary disease, or other issues that require that they cannot be able to do traditional general anesthesia, it may be another alternative option to pursue an option such as this. So the Spinal Simplicity offering is one that uses a percutaneous lateral approach. So what does that mean in regular English? What that means is that there's initially a wire or needle that's placed under X-ray guidance to a spot on the spine that we're trying to target. And that is then used in something that's called a Seldinger technique, which basically means you take ever increasing sizes of tubes over that needle or wire to be able to get to that location by dilating, or in essence, spreading that tissue apart without cutting it, so that you preserve muscle, you preserve ligament, and you preserve areas that are integral in terms of being able to provide support to the back and body as we know it. And then at that point in time, there is the placement of a device that provides stability by compressing the context of spinal processes. And those spinal processes are squeezed that provide stability from one level to the next. Why is this of value? Because it prevents that pain, that dysfunction, that movement, that slippage that can occur that can cause a number of different symptoms. And those symptoms include things like back and leg pain when standing for a prolonged period of time, pain that is present when sitting for a prolonged period of time, pain that can give you an issue that is relieved when you lean forward and bend forward in a kyphotic or slump position, pain that results from degeneration of either the facets or the intervertebral disc. And it allows for you to be able to have an ambulatory, meaning a same-day procedure that allows for you to go home as opposed to staying overnight with a drastically shortened recovery period. For many spinal fusions, it can take a number of months to sometimes as long as a year. For a percutaneous approach, it can easily take you from anywhere from 2 weeks to maybe a month for recovery to be able to start to do some of the activities that you'd like to be able to do. Are there downsides to this procedure? So there are times when you have a fusion where you need something that's called an anterior aspect or treatment to provide that vertebral body from slipping further. In this context, this procedure doesn't have something that would provide that option. But the upside is because it's a reversible treatment and it doesn't cut or take away tissue that's necessary for the fusion that would be a traditional fusion, it doesn't prohibit or prevent you from doing that more aggressive procedure in the future if you need it. Question of the day. If you had the option and you've tried other treatments, would you consider a minimally invasive spine fusion for improvements in both pain and function as an option for you? If you found this video of use, please hit the like button. And if you'd like to know about other topics that give you options for understanding improvements in function, decreases in pain, and basically how you can be able to win the fight by punching pain in the face and getting back to leading the life that you deserve, please hit the subscribe button. Thank you and have a great day.